It's Sunday evening. How are you doing, my dear? You're a supervisor. Do you have all the staffing you need? Is everything kosher? Are you stressed out? Did you just come on? Or are you doing a double like I used to do? Well, I just have a few words of encouragement for you. Hi, my name is Maggie. I am Nurse Training and Advocacy, the face behind the name. And on this channel, I provide training, mentoring for nurse supervisors and managers and help them to live their best life, to enjoy what they do, find balance, and find joy in their job. So please remember to subscribe to my channel, like the videos. I have a bunch of other videos that address different topics. So how are you doing? I remember I used to do 2:16 on the weekend. The hours were long, but I kind of liked the fact that I wasn't there during the week. I wasn't part of the clique. I kind of bypassed all that. So if you're working weekends and you're a weekend person, learn to enjoy it, because being there during the week, 5 days a week, and dealing with all that, and there's so much going on, it gets really a little bit noisy and busy, and everybody's there. So I loved working weekends. And the morning shift, depending on what was going on, was fine. But the evening, I did not feel that there was a big difference between day shift and evening shift. A lot of the staff rotated, they were doing their weekend rotation. Very few had a schedule like mine. So I understand not everybody can afford to give up their weekends. So that's why when I left that job, it was like, oh my God, I'm gonna be normal again, whatever normal is. Because when you work weekends, sometimes you miss out on things. People go out, they have weddings, birthday parties, and you might miss out. So you're talking to somebody who's done it. When I did the 2:16, Sunday night was a happy shift for me, because that was my fourth shift, and I was looking forward to being off for the weekend and sleeping in on a Monday. So I did a live yesterday, which I'm doing every Saturday at 6 o'clock. So if you ever have some time, just go ahead and tune in on Nurse Training and Advocacy on YouTube. And I usually do it also on Facebook, because we got the channels on both platforms. So, but I keep the lives on. Some of them, I think originally I was clicking the 30-day thing, and some of them, I should say, keep them on forever, right? Because the topics are relevant. There is one class that I did. It's called the 10 Habits of Highly Effective Nursing Supervisors. And I think then I break it down, to the different habits. So there are different topics, different videos. So, if you're not doing anything, you have a long drive, just go ahead and scroll and listen. I guarantee you they're not boring. I like to just talk about something that I'm passionate about. But today in the afternoon, you know what happens in the afternoon. You already had your discharges, right? So you may get some admissions, even though during the week, as you know, most of the admissions do come on 3 to 11. So on the weekend, you do not have to worry about getting too many, but you're still gonna get some. So I hope you're comfortable doing your admissions. Yesterday we did our talk on organizational skills, And one of the skills you need to acquire and master is knowing how to do these admissions. There is nothing worse than doing the admission on a weekend where you don't have any support, and then people calling you on Monday or when you come back next week saying, oh, you didn't do this, you didn't do that, okay? So if you need to sit down with someone, if you need to come during the week to just get more training, do that. It will make your life a lot easier because you need to master, I don't know if you're using PCC, point click care, you need to master how to do put the diagnosis in, adding the ICD-10 codes. You may want to get yourself a little cheat sheet as to the most common ICD-10 codes. And when I do have the class, I will have a few of them because, you know, most of the codes are the same. The people come with, you know, hips and knees, diabetes, AFib, some nucleostomies, you know, COPDs, pneumonia. Thank goodness right now we're not like in a COVID, you know, alert. We don't have a lot of high COVID cases, but even the COVID, you know, the orders were usually the same. So learn how to put those orders in and do the coding. They don't expect you to be perfect at the coding, right? Because they do have, I think MDS or whoever looks at them, make sure because there's a sequence to coding. You have to know which diagnoses to put where. So learn that, and then know how to schedule your appointments. And if people have follow-ups, you know, how do you let the secretary for the next for the week to know that you know, their books or put it, you know, your dialysis orders, know how to do that. Your batch orders, your IVs, you know, there's a lot to learn. And if you are the supervisor on the unit on the weekend, it's gonna fall on you to do all that. So make sure you get some training, and don't be afraid to ask to be trained, because what's gonna happen usually is that your manager or DON, they're just gonna throw you, you know, in there to the wolves, and you don't want to make a mistake. You want to make sure you are doing that correctly. And then getting the chart together, right? Scheduling your skin checks. You know how important those are. Let's see, what else did we do with the admissions? Follow-up appointments, you know, sending the orders to pharmacy, making sure if somebody had surgery that they have their pain medication. Make sure you get the script. You spend a lot of time chasing things because a lot of times they don't send them with the stuff. So you end up spending a bulk of your time on the phone, calling pharmacy, asking for this, asking for that. Especially one major issue that patients experience when they come to a nursing home is not having their medications there right away. And when you try to explain to them, we do not have a pharmacy on site, it goes way, they don't understand. And then they're calling their family members saying they're not getting their pain medication. So yeah, that can be a little tedious. So do what you can. Once that patient hits the floor, as they're putting the patient in, grab that order sheet, you know, the medications that they send, and send it to pharmacy, right? That way you can decrease the amount of time it takes for you to get, you know, fax the script, fax the list of meds. And then if you fax the script, even if it's for the 3 days, then you'll be able to call, get a code so you can go into your EDK and get some medication. So it's all about being proactive and being organized, right? Because if your patient is settled in and they get their pain meds, you make sure you send the script, the slip to dietary that they can get some food, hopefully if they come before lunch. I don't know if your facility has the ability for you to go into the kitchen. Sometimes you can go if the resident arrives like after 6 or something. and the kitchen staff is gone, if you have the key to the kitchen, you could probably go and get him a salad or something. Because again, you're trying to be proactive and keeping that patient calm so they don't start, writing grievances and complaining. So I do encourage you to, learn to organize yourself. What else do we do in the evening on a 3 to 11? You can have your sundowners, right? They start acting up. And because every building is different, some buildings have one CNA assigned to a day room where they can keep an eye on those people. Some facilities don't. I have had to keep them close to the nurses station. So just kind of plan ahead for those. That's the thing. Don't be caught off guard. Expect that. And then on the weekend, on a Sunday like that, you're going to have family members. So I think if you go around and you say hello to them, you introduce yourself, it kind of gives them a sense that you care, you're a professional. So spend a few minutes just interacting with your visitors. It goes a long way. People don't realize it. And you will say, oh my God, I have so much to do. Yeah, you do. You do. No one's going to say you don't. But taking that extra time is going to pay dividend, right? So I encourage you to be proactive and organized and expect the unexpected. And then you're going to have the med, pharmacy comes and you have to do all that. I didn't like that part of the job, but it is what it is. So lots of encouragement, lots of love from me. Look forward to you. Go look at those videos. If it's in your car, I'm in my car right now, you can go to YouTube, put the channel in, and just scroll. Try to use your time wisely. Don't listen to negative news, and just use your time, and educate yourself. And that's what I think I tell people, the power of positioning. Positioning is making yourself highly qualified, highly valued, highly skilled, so that if a facility is not treating you right, you have options. I'm not one to say jump ship for 50 cents there, because nurses, we don't jump for 50 cents. When nurses leave their jobs, it's usually because they're being treated poorly. There's a disconnect between them and the management, and management is giving off the idea that we don't care. I think those are the things, and them working you to death, not supporting you, letting patient visitors treat you all kind of ways, not having your back. I know how that feels. So, but we all have our reasons, personal reasons for why we stay in this job. So be encouraged. You have more power than you know, and our job is still sacred. When we look at these people who depend on us, it is a sacred career and position. But at the same time, I encourage nurses to be assertive and not roll over and let people walk all over you. Know your worth and demand what is due you, okay? Don't work for pennies. Make sure you get the whole package, and speak to your managers as professionals. Don't let them make you feel guilty. Be ready to speak eloquently about what you need to do your job. Okay? I hope to talk to you soon. I'm going to be doing those a little bit more frequently, but smash that like button. Please subscribe to the channel, because if you like the video, then YouTube is going to show it to other people, and we need to grow our channel. We're relatively new. We only have a few subscribers, but for me, it's not so much about subscribers. It's about finding the people who need to hear the message, because we all need encouragement. Okay? All right. God bless you. I love you. Au revoir. À la prochaine.